Hi there, I'm Francisco Ibanez Carrasco. I'm the Director of Education and Training at the Ontario HIV Treatment Network, and this is part of our series of OHTN researcher profiles. We're here today with Dr. Rupert Cole from the University of Toronto and the University Health Network. I'm going to ask you right off the bat something you don't expect. You have an accent. How did you get to Ontario and to do this kind of research in HIV and AIDS?
Oh, those are two very different questions, I guess, right? So I do have an accent. I don't really know what it is. I'm from England originally, so I was born in England. My family emigrated when I was a kid, actually, to Canada. So we lived in Newfoundland for a while, and then Ontario, Northern Ontario, and then came down to Toronto for university. But high school, basically, we came to Canada when I was 3, and when I was 7 or 8, they sent me back to boarding school in England. So I went to boarding school in England until university. So the accent, I guess, comes from school and from my grandmother, probably, because that's where I would be staying while I was at school. Actually, I was originally planning on being a cardiologist. That was the original plan, and looking after hearts. But I did infectious disease. My sort of mentor in terms of the clinical side was Dr. Hilla Valland, who's a great infectious disease teacher, clinician teacher at University of Toronto. And he, coincidentally, was taking my group, teaching us internal medicine. And so he got me very excited about infectious disease, and I went into the infectious disease training program to train as an infectious disease specialist. And then obviously that was at a time where we had no combination therapy. HIV was a very different disease to the HIV that we have now. And I had the option to go and do some research around, after I finished my clinical training, to do some research around people who are exposed to HIV but seem to have a reduced susceptibility to HIV in Kenya. And that was really where I got interested in HIV and looking at the immunology of how that worked and trying to understand how people were acquiring their HIV, which of course is acquired in the genital tract. It's a sexually transmitted disease, across a mucosa, either genital, rectal, foreskin mucosa. That's what really got me interested in looking at the immunology of those sites, which is really the big focus of my research now, is understanding how the immunology of the places where we get exposed to HIV influences our risk of getting HIV when we're exposed.
And that's what you mean when you say that you've covered the waterfront.
Well, when I say I cover the waterfront, I think the original research I was doing when I went to Kenya was in female sex workers, so women who are at very high risk of HIV infection. And some of those women were exposed to HIV and didn't become infected, so that was the basis of my PhD work, I guess, was looking at that relative resistance to HIV. But of course, you know, people are also exposed to HIV on penises and in the rectum and in the oropharynx to some degree, although oral sex is much less likely to transmit HIV. And so we subsequently, after coming back to Toronto and setting up a research lab here, we now do research that involves rectal immunology as well as foreskin immunology, semen immunology, because semen is the vector for most HIV transmission globally, if you look at the raw numbers and get down to the nitty-gritty of how things are transmitted. And the level of HIV in semen is very variable from one person to another and is dramatically altered by treatment, HIV antiretroviral treatment, as well as genital infections and a number of other things that we may or may not be aware of.
And what particular, if you had to think of 3 particular kinds of research studies that you're involved in at the moment, what would they be in terms of your interest and what's, you're passionate about?
The first work that I was doing in terms of research was working in Kenya with a very marginalized group of female sex workers. And one of the very neat things, it wasn't me who set it up by any means, it was Frank Plummer and the program from Winnipeg. It was the University of Winnipeg that founded that program. So they had a great system where obviously some very groundbreaking, I think, research was being done there, some very interesting research. But every year there would be a baraza, like a sort of community meeting with all the members of the community where it was a whole day thing. And there would be sort of food and celebration and singing and stuff like this. And we would present the latest research that we had done and what we had found, and get feedback on what research was needed from the community. And people would tell us very bluntly. I mean, it was an entertaining, it was always before Christmas, right? The Christmas baraza. And we would get very blunt feedback about what was working and what was not working in the clinic, like what services were needed that weren't being provided, those sorts of things. And I think that what you could see when you were in it as a trainee was that really you know, that really enhanced the program. I mean, I think that people could see that the research team were responsive to that feedback, and that really helped. I think the research that helped build trust, you know, and it meant that we were working on things hopefully that were important and that were identified as being priorities within the community. And so, you know, coming back to Canada, then the OHTN was here and had a very similar philosophy to how they wanted research to be. You know, to be conceptualized and to be performed, and then the research results to be fed back. So it's always seemed like a very natural thing to be doing that. Like that's, and I guess if you know, are a much more basic researcher where you focus much more on cell lines or things in the test tube, that may be a more difficult thing to. You know, you don't plan that. That's not necessarily part of what you have to do, and so maybe that's, you know, a more difficult thing for the OHTN to bring about, which I think they've done very well in all settings. But it's always been fairly natural, I think, for somebody who does translational research to have that as, and that's, you know, that's how it should be, really. I mean, because there are lots of things that I find intellectually interesting that would be fun to chase off and look at, but if it's at the end of the day, if it's not important to people in the community, then why would we be spending our resources doing that? So
the last thing I want to ask you is when you're, you know, you have a student for a while, or a person you're mentoring. What is the greatest piece of advice that you give them in terms of their career in HIV? I know, you know, there are many other fields in which they'll go, but what is the advice you give them?
Well, I mean, I think the main advice is really independent of anything to do with HIV. I guess, you know, the main advice that I have for students in all, you know, whether it's on the clinical side or on the research side, is you should be doing work that you really like. So, and I think the best way to succeed in whatever it is that we're doing is you should be doing something that you really enjoy. And when you wake up in the morning and you think, oh, I'm going to be out there and I'm going to be, you know, this is what I've got on the table for today, if that doesn't make you feel good and make you want to go out the door, then, you know, you should reevaluate whether that's the right area for you. And I think that certainly when we're talking about people who are going through their clinical training and saying, oh, should I go into this specialty or that specialty? So you should go into the specialty that really switches you on and that makes you excited. And you shouldn't be going into a specialty because there are some jobs out there or because of, you know, because it pays more or less or anything else. You should be doing what you really enjoy doing. And I think that's one of the things I still can't believe, really. I mean, when I finished my clinical training and I started my research training and I was doing a PhD, it was just amazing to me that here I was a PhD student, and I was just sitting there and thinking about, you know, what would be interesting questions to address, and then what would be the logical way to go about addressing those questions. And, you know, this is my job, you know. And then when I like as a PhD student, and then when I finished and I, you know, I'd got the PhD and people said, oh, well, you know, the people at University of Toronto, when they were potentially talking about a job, said, oh, well, what would you like to do? I said, well, I think I'd like to be doing, you know, mostly research about this balance, and, you know, but I'd like to maintain involvement with patients and some personal contact as well. And they said, oh, sure. So basically, you know, you sort of had the opportunity to say, how would you like to balance your time? And then people said, yeah, okay, that sounds good. And so I think that I can never complain. The downside is I can never complain and whine about my job, of course, because it's my own. It's a job of my own making, right? But I think it's great to be able to do exactly what you want to do. So I mean, in terms of the HIV piece, I mean, people should be working with issues important to HIV if that's what they find exciting. If that's what they find exciting, there are going to be two reasons for that. One is just that, you know, HIV itself is a very interesting virus. And I think that people who are approaching from the basic side just think, oh, this is a really unique challenge intellectually. And I think people often coming from the clinical side, you know, they like it because providing care for people with HIV is a really, you know, there are unique aspects of that are challenging but also very rewarding. And I think that we can make a tremendous difference, especially if you do it the right way. You can make a tremendous difference, I think, to the lives of people who are living with HIV, and that's a very rewarding thing. So, you know, you should be seeing that and saying, yes, that's what I want to do. I see that's a rewarding thing. And in that case, okay, come on in. You know, those are the people that we... But I don't think you can make that. If that's not there in the first place, you know, you can't really build that in. So that's what you have to try and screen for a little bit when you're taking on students. What is the motivation for coming in? You know, why are you coming in? And hopefully that's something that is there from the beginning rather than something that wasn't there at all. And I've had to make that in somebody, because I don't think I can do that. I maybe, no matter what kind of a teacher you are, I don't think you can make somebody like something they're not very interested in.
Rupert, thank you very much for coming and talk with us about your scientific and your clinical career. And thank you for watching another installment of the Researcher's Profile.